an integrative doctor specializing in women's hormonal health, and I've partnered with Thinx to talk all things periods and hormones. A huge problem that I hear from people that I work with is that they have no idea what is going on in their bodies when they have a period. So let's talk about that. I want to show you the hormones that are involved, why they're important, and what they do. So here's what a healthy cycle looks like. We have two phases, your follicular and your luteal phase, and it's broken up by ovulation. I first want to start talking with estrogen. This is the hormone we all think about when it comes to our periods and our cycles, right? We hear estrogen this, estrogen that, estrogen, 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 and it often gets a bad rap. We always hear about estrogen being bad or needing to get rid of estrogen. And I'm not gonna lie, it is responsible for a good bit of those negative symptoms that you might notice around your period, but it's not there just to make you feel awful, right? It does have a purpose. And the purpose of estrogen in our cycles is to help build our endometrial lining. So in our follicular phase, estrogen is that builder hormone. It's thickening the lining and preparing your body for fertilization and implantation. That endometrial lining has to be thick enough to support these processes, which is what estrogen's job in that follicular phase is. So as estrogen rises, when it reaches a peak, it triggers to your brain that we're ready to release that egg. So FSH and LH then kick in. And FSH is the follicle stimulating hormone. This hormone is responsible for finishing the maturation of your egg or your follicle. And then we have LH. And LH is the luteinizing hormone. And this one is responsible for releasing the egg or the follicle. And LH is what we are tracking with those over-the-counter OPK strips. So if you are trying to conceive and you have those ovulation strips, this is what we're testing. The spike in LH that happens right before you ovulate. Because LH is going to spike about 12 to 36 hours before you ovulate. But if this is the only thing that you're using to track ovulation, we don't actually know for sure if you ovulated, because a lot of people with some hormonal issues will have elevated LH levels even though they're not ovulating. So we're only predicting when you might ovulate with those LH strips. And this is why we confirm in some other way with basal body temperature or progesterone testing or some other way that's going to validate that you did ovulate. Right, now that we've ovulated, we move into our luteal phase. And this is the phase from the time you ovulate until the next time you have a period. And usually this lasts about 10 to 14 days for most people. If it's shorter than 10 days, then we might want to consider getting our hormones checked, and especially looking into progesterone levels, because this is the phase where progesterone is the dominant hormone. So the sac that released our egg or our follicle is now secreting progesterone. And what does progesterone do? It helps oppose estrogen. So estrogen's job was to be the builder hormone of that endometrial lining to grow thicker and thicker until it reached a certain point. Progesterone's job is to just help to maintain that lining and make sure estrogen doesn't take over and keep growing the endometrium. Progesterone is also our chill hormone. It has calming effects because its metabolites bind to our GABA receptors in our brain. It helps with anxiety and stress in the second half of our cycle. And progesterone also has anti-inflammatory effects. This is why for some people, when they get pregnant, their issues seem to disappear, right? If they had autoimmune issues or gut issues or psoriasis or eczema or certain conditions like that, they seem to go away during that time. That's because of progesterone. We have all that progesterone helping us out and being anti-inflammatory, so you see these issues start to be resolved during pregnancy, and that's the reason why. Progesterone also raises our basal body temperature by about 0.5 degree to 1 degree Fahrenheit. So this is why if you track your temperature, your basal body temperature, once you ovulate, you will see a rise or a spike in temperatures that stay elevated if you have healthy progesterone levels. Now that you have the 101 on your hormones and your cycles, I want to talk to you about why you might be getting those PMS symptoms. So these symptoms could be pain, they could be headaches, they could be migraines, they could be mood swings or breast tenderness. You might notice some spotting or irritability or even night sweats. And for most people, this happens in the luteal phase, usually about that week or 10 days before your period starts. And this could be due to high estrogen levels in the luteal phase. It could be due to low progesterone levels, or a combination of both of those things. If you have higher levels of estrogen, when they drop from way up high to nothing right before your period starts, this can trigger a lot of those symptoms like mood changes and migraines and headaches. So if you have symptoms that are always popping up in those few days before your period begins, then it's really worth it to consider getting a full workup of your hormones and getting those things checked out. But do keep in mind that this video is just intended for educational purposes. It doesn't replace seeing your doctor, so make sure if you do have any of these concerns, you're checking in with your doctor. Now I hope you have a little bit better understanding of what's going on with your hormones, your periods, and why you might be seeing some of the symptoms that you're noticing.